Hello, today I want to demystify biologic medications for you all. I know that this topic can be extremely terrifying for many IBD patients, especially when your doctor tells you, look, you have moderate to severe disease and your body really requires a biologic. I know that it was hard for me to receive an IBD diagnosis, and it was very, very hard for me to accept that I may have to go on a biologic. For me, the first biologic I went on was Stelara. I did not want to believe my body needed it. It scared me. And then you watch the pharmaceutical commercials and they go through the long list of side effects that may happen if you take this drug, and it can be very overwhelming for patients. So, because of that, I thought that I would kind of demystify biologics and empower you with knowledge so you don't have to be as terrified, because I literally lived in fear that I was going to develop cancer because of my biologic for years, which is a huge reason why I spent so much time in the holistic health community, because I was desperate to that any of their natural remedies, their diets, their, wellness trends would heal my body so I didn't have to be on medication. And I always said, well, I'm only on a biologic for now. It doesn't mean I'll be on a biologic forever because I'm trying these natural things and it will be better. And well, the natural things didn't work for me at all. My body required biologic, and my body also was still very ill when I would develop an immunity to the biologics, and I would start flaring again. So let's talk about the numbers. I had the opportunity to interview a gastroenterologist and a researcher, IBD researcher from Johns Hopkins University. And so patients on biologics, roughly 1 in 1,000 patients may develop cancer. So what does that mean? It means, they may see melanoma. For women, they may see cervical cancers. Those are the two most common. There are also other cancers, but it really is low. If you are on a biologic alone, you are less likely to develop cancer. Now, obviously, you can be like, we have non-IBD patients that develop cancer, right? There are a lot of things that go into this, so we never really know. But if you are on combination therapy, say you're on a biologic and azathioprine, or a biologic and methotrexate, and you've been on it for a couple of years, you are still at an increased risk. But again, the risk is extremely low. It is more of a risk to you to not be on your biologic. And for us with IBD, 30% of us require biologic therapy. There is 70% of patients with mild, 70% of IBD patients have mild disease. They do not require biologic therapy. And to those of you who are the 70%, like, congratulations. And I genuinely mean that, because I really wish I could be in that 70%. But for me, my disease is, moderate to severe, and I require the biologic. If I stop taking my biologic today, which I'm on Stelara, if I did not do my injections every 8 weeks, I would absolutely start flaring. My first biologic was Remicade. It didn't work for me for the first 6 months I was on it, 6 to 8 months. They doubled the dose. They maxed me out. And it did give me relief for about 8 months. And then sadly, my body built up antibodies to the medication and it stopped working for me. So then I was like, well, this is a great opportunity for me to, really, really, really hone in on holistic health trends. This will really help. And yeah, they didn't, because again, my body needs a biologic. And so I ended up going on Humira, and that is similar to Remicade. However, Remicade's an infusion, Humira is an injection. At the time, it also still had citric acid in it, which it doesn't anymore. So if you are on Humira now, and you didn't have it when it had citric acid, I'm so happy for you, because it was so painful in the past. It really burned, and I literally cried when I had to do that shot. I was also pregnant when I went on Humira. And so it was very overwhelming and hard. But the drug company decided to take out the citric acid. Thank you so much for doing that, because then it became relatively pain-free. However, I had already built up an immunity to the drug by the time they did that. So I did not get to ever experience Humira pain-free. I mean, the needle always is a little, touch and go, but it burned really bad when I had to do it. And removing the citric acid also removed the intense burning sensation. With Humira, I developed lupus-like syndrome. My face literally looked like it was ulcerating off. I had rash all over my body. I felt like I constantly had fleas. It was very miserable. So yeah, that drug, the anti-TNF biologic class, is closed for me. However, I know a lot of people with IBD and other autoimmune disease who have been on Humira for years and have done great. So by no means am I telling you to not take Humira, or if you're on Humira, and you're doing well, that's amazing. I had a reaction to it. Not everybody has that reaction. And just because it didn't work for me does not mean it won't work for you. Just because I had those side effects doesn't mean you won't have those side effects. But I'll tell you more about the Humira story, and I will show you photos because it stumped a dermatologist for 2 to 3 months. It also stumped my gastroenterologist at the time, because he was like, I just don't understand why your face is doing that. But I think looking back, because I had blown through so many drugs and I was getting close to not having medication options, he was thinking, let's hope that it is a reaction to something else and not the drug. And by doing so, he did a great disservice to me, because I was extremely miserable. I couldn't go to my friend was getting married. I was a bridesmaid. I could not go to her party to try on dresses, because honestly, they probably would not have let me try on a dress with the way my face and my skin looked. And honestly, I didn't want to try on a dress with rash everywhere. It was horrible, and that would be rude, and I didn't want to do that, but it was rough. I did fire that gastroenterologist, and I saw a new gastroenterologist, and he was fantastic. And he's like, oh, this is lupus-like syndrome. I'm glad you stopped the drug. This is, you shouldn't be on it. Anti-TNFs are closed for you, and then he discussed Stelara. I told him no, I didn't want to do that. I wanted to, try the natural route again. This was an opportunity for me to really, really hope that the holistic health trends and diets will work for me. And I'll never forget, after a colonoscopy, he's like, look, you have inflammation in your colon. I know you have symptoms. It's not great, but okay, if you want to try the next diet, then try it, but your colon's inflamed. And so I thought to ask him, well, okay, since I am in a chronic state of inflammation, what are the chances that I'll develop cancer in the future by not being on a biologic? And he said, if you choose to not go on medication, a biologic that I'm recommending for you that will be best for you, he said, next year, probably not. When you're 60, yes, you may have colon cancer, and, because you can't be, or sooner, right? He's like, your body, your colon, your digestive system, you're just a constant inflammation. The biologic will calm that. And so at the time, my mom had just turned 60, and, I had my 2 children at that point, and I thought, I should probably go on the biologics. So he put me on Stelara, and I have now been on Stelara for almost 4 years now, which is really surreal, because it took about 8 weeks for me to, July, August, roughly 4 months. It took roughly 4 months for me to go into an absence of symptoms with Stelara. And then my follow-on colonoscopy after that, I was actually in clinical remission, which was extremely rare for me, because usually my body is in chronic inflammation and I am always flaring. I do up to that point, and I always had ulcers in my colon. It was really rough. So Stelara is the first biologic for me that has actually, has kept me mostly controlled. I still do have blood and mucus sometimes, but I can control my bowels. Mostly my colonoscopies look fine. So, it's the first time that I've gone this long on a drug, and I haven't built up antibodies to it, and I'm actually tolerating it quite well. And I have gotten sick a lot less. So when I was on Remicade and Humira, I would get huge cold sores. I got shingles. With Stelara, I have not gotten sick more than, probably more than normal, but I have not been as sick as I was when I was on Remicade and Humira. So really what I want to tell you is it is scary to find out that your doctor is recommending a biologic, but know that you are roughly part of the 30% and you are in good company because I am with you. I understand your struggles. I understand how scary it is. The drug commercials, which I really wish that they didn't do those, but basically the drug commercials, they have to tell you like literally the side effects that people in the studies have, what has happened. And they're required by law to do that, but it is very overwhelming for a patient to hear all of that, because when I hear those things like they developed leukemia and et cetera, et cetera, et cetera, et cetera, or, not developed, I should go back, not saying they developed, you're at an increased risk for it. You may be more likely to, and then they say develop leukemia, et cetera, et cetera. When I hear that, I automatically think, because I suffer from like, what if, I always think what if for everything in my life. And I was just like, oh gosh, that's going to be me. That's going to be me. Oh my gosh. And I actually went through a moment, a couple years ago where I have what's called thrombocytosis, which basically my platelets are quite high. And so I was getting tracked by just my normal doctor for a while, and she started noticing a trend. Each year my platelets would increase. And so she called me and she said, look, you need to go see a hematologist. Sometimes the only way we can catch certain leukemias is through the slow increase of platelets. And I was already outside the normal range. So it was at that moment when I met the hematologist, and I thought to myself, is this the time? Is this the time that I find out that I develop leukemia? And I naturally thought, oh, well, if I do have it, it's probably because of the drug. But that also wouldn't be true, because again, just like IBD is multifactorial, so are cancers. There's very rarely is there ever one cause, right? Like our bodies are complicated. And so, but I looked back and I reflected on the several years I had been on biologics, and I thought, those drugs gave me my quality of life back, because one, without them, I would either be steroid dependent, which we know being on steroids long term is not ideal, or two, I would be dead, because my body needs medication. No matter what natural route I've done or tried, my body needs medication. And so just the huge reflection that I had a couple of years ago was like, well, I really couldn't have done anything different, because my body needs medication. And it turned out that no, there was no leukemias, but they said, we're just going to continue to monitor you throughout, every 3 months just to make sure. So now here I am, roughly 2.5 years later, and my platelets have continued to climb. And I'm kind of digressing here, okay? I'm not saying that this is because of the biologic. That is by no means, I'm not saying that it's not because of that, but it's just, this is what my body is choosing to do. So, I am seeing a new hematologist in December, and we'll see what they say. But it just is. And what was most important for me is that the biologic medication, one, stopped the inflammation in my body, and two, gave me my life back, because I absolutely would not be able to take my kids to their hockey practice. I would not be able to walk them to the bus. I would not be able to do my dietetic rotations for grad school, because I would have to be always next to a bathroom, because when I flare, I cannot control my bowels. It is very, very difficult. And my body usually goes from 0 to 100 within 3 weeks. So basically going from no symptoms to, oh my gosh, or minor symptoms, as in, oh, I noticed some blood in my poo, to, oh my gosh, I better get to a bathroom within 10 seconds or less. And so biologics have given me my life back. Again, roughly 30% of us with IBD do require biologics. And you know what? That's okay, because it just is. Why were we dealt this card? It doesn't matter. The point is, this is what this is what our reality is. And, the sooner we accept it, the better off mentally we'll be. And so I just want to tell you, I've been on biologics for several years. I know how hard it is to accept the fact that, your doctor's recommending that, but also I know how scary it can feel, how doom and gloom it can feel. But I just want you to know that oftentimes if your doctor recommends, your gastroenterologist recommends that you go on a biologic, it's for a reason. And many of us with our symptoms, we have a decreased quality of life. If we can't leave the house, if we have debilitating, digestive pain, if we're pooping blood, mucus, all of those things, it's not healthy. And so obviously it's not healthy. But if any little bit of quality of life we can get is important. And so I have finally accepted it, but it took me years to accept that I am okay being on a biologic, because you know what? It's not good or bad. It just is. And my body requires it. And that's the card I was dealt, and I'm just going to roll with it. And so, but just know, if you are scared of your biologic medication, I understand. I've been there. If you have any questions, leave them in the comments below. I will absolutely answer them. You are not alone. And no matter what is going on in your life, whether it's great or whether it's terrible, whether you're flaring or whether you're in remission, know this: always keep moving forward, because things eventually will get better. And sometimes they get a lot worse before they get better, but at some point your disease will stabilize. Never, never, never lose hope. Let me know if you all have any questions about biologics. I hope this kind of demystified it for you and made it less scary if your doctor told you you have to go on it. But I hope you all have a wonderful day.